Welcome to this video. I am Dr. Malauk Tamaska. Today we will see how to take a pediatric history. I hope you will enjoy this video. These are components of pediatric history. Among those, I will focus on components specific to pediatric history. So we will see past medical history or perinatal history, immunization history, nutritional history, and developmental history. Identification, it gives full information about the patient. In pediatric history, name of the patient as well as name, age, and occupation of the parents should be included. Age and sex are very important in pediatric history because there are many age and sex specific diseases. Age and sex are useful for growth monitoring and for drug prescriptions. In the first 72 hours of postnatal period, age is specified with hours. After 72 hours of postnatal period, age is specified with days, weeks, months, and finally with years. Childhood categories. Newborn or neonate is the first neonate days of life and it is classified into early and late neonate. Early neonate is the first 7 days of life. Late neonate, those between 8 to 28 days of life. Infant includes those under 1 year of age. Toddlerhood, those between 12 to 24 months of life. Preschool or early childhood, those between 2 to 6 years of life. School age or middle childhood includes those between 6 to 12 years of life. Adolescence or late childhood includes those between 12 to 20 years of life. And again, it is classified into early, middle, and late adolescence. Perinatal history. It is crucial particularly for neonates and infants. Prenatal history. In this section, you should ask nutritional and health status of the mother during pregnancy, her ANC follow-up, history of iron, multivitamin supplementation, tetanus vaccination, medication intake, history of alcohol drinking or smoking if any, and gestational age of the pregnancy. Labor. Duration of labor, rupture of membrane, meconium staining should be asked. Delivery, whether it is home delivery or hospital delivery. Birth weight, neonatal period, is there any resuscitation or neonatal jaundice, infancy and childhood illnesses and surgical conditions should be asked in detail. The other component is immunization history. You should ask the age when vaccination was started, type of vaccination or route of administration, dose, and adverse reactions. Severe adverse reactions are a contraindication for subsequent vaccination of that specific vaccine. This is the API schedule in Ethiopia. Knowing the API schedules facilitates your history taking. At birth, BCG and oral polio vaccines are given intradermally and orally respectively. At 6 weeks, pentavalent, which protects from diphtheria, pertussis, tetanus, hepatitis B virus, and Haemophilus influenza type B, pneumococcal conjugated vaccine, oral polio vaccine, and rota are given. Pentavalent and pneumococcal conjugated vaccines are given intramuscularly, whereas oral polio vaccine and rota given orally. At 10 weeks, the second dose of pentavalent and pneumococcal conjugated vaccines, oral polio vaccines, and rota are given. At 14 weeks, the third dose of pentavalent vaccine, pneumococcal conjugated vaccines, and oral polio vaccines are given. At 9 months, measles vaccines given subcutaneously. Nutritional history. Ask whether it is breastfeeding or formula feeding. If it is formula feeding, ask the reason for formula feeding. Duration of exclusive breastfeeding. Duration of breastfeeding. Initiation of complementary feeding. Type of food, amount and frequency of feeding. And finally, sunlight exposure and how the mother exposes her baby. Importance of breast milk. It is recommended to initiate breastfeeding as soon as possible within 1 hour of delivery, and it is recommended to exclusively breastfeed for the first 6 months unless there is a clear contraindication and continue feeding to 2 years or more. Breast milk provides all the nutrition a baby needs in the first 6 months. And it is first immunization of the baby. Protects against common respiratory and intestinal diseases. Has long-chain omega-3 fatty acids that are important for brain and retinal development. Breast milk is a clean source of food. It is ready-made and no need of preparation. It helps the uterus return to its normal size. It reduces anemia, helps to suppress ovulation and bonding and attachment. It increases positive mother-to-child relationship. For effective breastfeeding, there are 5 steps to be followed. The first one, position the mother. The second one, position the baby for breastfeeding. The third one, attach the baby to the breast. The fourth one, check for good attachment. The fifth and the last one, check for effective sucking. Let us see position for breastfeeding. The baby's neck straight or bent slightly back. Baby's body close to the mother's body. Baby's whole body supported. Baby facing the breast with nose opposite to the nipple. The other is attachment for breastfeeding. It is ways to help the baby attach to the breast. The mother should hold her breast in a C-hold. That means thumb on the top and other fingers below the breast. Then the attachment is good when the baby's chin is touching the breast, the baby's mouth is wide open, the lower lip is turned outward, and when you can see more of the areola above the mouth than below it. The final component is developmental history. You should ask ages at which milestones were achieved and current developmental abilities. Growth versus development. Growth is an increase in size and changing of a living organism from simple to a more complex form, whereas development is a maturation of organs and systems and acquisition of new skills. Growth and development are continuous dynamic processes occurring from conception to maturity. The sequence of development is the same in all children, but the rate of development varies from child to child because there are many factors affecting growth and development. Development proceeds in a cephalocaudal direction. That means controlling head precedes controlling of hand and legs. Development proceeds from the simple to the complex and from the general to the specific one. There are critical periods for growth and development. For instance, brain development is high during the first 2 years of age. Knowing the normative pattern is important for early detection of deviation in child's pattern of development and also for history taking. There are many factors affecting growth and development such as heredity, prenatal and postnatal environment, sex, endocrine system, disease and nutrition. These factors can affect the rate and pattern of growth and development. Growth can be assessed by different measurements. The first one is weight. It is the best index of growth and nutrition because changes in weight occur first in acute and chronic conditions. The average weight at birth for normal term newborn is 3.4 kg. Height and length. Changes in height are slower in response to factors. Height is affected in chronic conditions. The average child's length at birth is 50 cm. Head circumference. It serves as estimate of brain development. The average child's head circumference at birth is 35 cm. Assessment of development. Development has 4 components: gross motor, fine motor, cognitive and social skill, and language. The acquisition of gross motor skill precedes the development of fine motor skills. So let us see one by one. The first one is gross motor. It includes gross muscular activity, including posture, independent mobility, and progress from head control to running and even jumping. At 3 months, infants can support their head. At 6 months, they can sit without support. At 8 months, they can crawl. At 12 months, they can stand without support. At 12 to 15 months, they can walk alone. At 18 months, they can run stiffly and walk upstairs with one hand held. At 24 months, they can run well, walk up and down stairs, and climb on furniture. At 2.5 years, they can go upstairs with alternating feet. At 3 years, ride tricycle and stand momentarily on one foot. At 4 years, they can hop on one foot, and at 5 years, they can jump. The second one is fine motor. The ability to reach for, grasp and manipulate objects. At 3 to 4 months, infants can grasp objects. At 5 to 6 months, they can transfer objects from hand to hand. At 9 months, they can have pincer grasp. At 12 months, they can scribble. At 15 months, they can make a line and insert a pellet in a bottle. At 18 months, they can imitate vertical stroke. At 24 months, they can imitate horizontal stroke, turn the page of a book, and open a door. At 3 years, they can copy a circle and build using small blocks. At 4 years, they can throw a ball overhead and copy a cross. At 4.5 years, they can copy a square. At 5 years, they can copy a triangle. Third, cognitive and social skill. At 6 to 8 weeks, they develop social smile. At 4 months, they can laugh. At 6 to 8 months, they develop stranger anxiety. At 9 to 12 months, they know object permanence. At 15 months, they indicate their desire by pointing. At 18 months, they can feed, complain when wet or soiled, and kiss their parents. At 24 months, they help undress and listen to stories with picture. At 2.5 years, know their full name and pretend place. At 3 years, know their age and sex and count 3 objects and work their hands. At 4 years, they can tell a story. At 5 years, they can name 4 colors, count 10 objects correctly, and dress and undress. Language. First 6 months, they sound vowels. At 7 months, they start with consonant. At 8 to 9 months, they can say dada and mama. At 12 months, they know few words. At 15 months, they start to speak in jargons and follow simple command. At 18 months, they know 10 to 15 words. At 24 months, they can make 2-word sentence. Eventually, their language develops most rapidly between 2 to 5 years and their vocabulary increases. Number of words in a sentence equals age in years. Red flags. These are indicators of suboptimal development. Includes unable to sit alone by age 9 months, unable to walk alone by 18 months, unable to transfer objects from hand to hand by age 1 year, abnormal pincer grasp by age 15 months, and failure to speak recognizable words by 2 years. This is all about history taking in pediatrics, and if you have any questions and suggestions, please write in the comment section. Thank you.